Good afternoon and welcome to the CMT&Me 2023 webinar with CMT UK. My name is Simon Bull. I'm the Chief Executive of CMT UK, and our members provide a lot of information via the app on CMT, on how it affects them, how long it takes to get a diagnosis, the medications, therapies, and the aids commonly used. We learn from this how the condition impacts lives, careers, and relationships. And today is an opportunity to give you, the person with CMT, some feedback. One finding is that the length of time taken to get a diagnosis is frankly far too long. When effective treatments become available, as surely they must, it will be important to start them as early as possible before disabilities become established. By raising awareness at every stage of the diagnostic pathway, hopefully it'll enable a much earlier diagnosis. Today's webinar focuses in more detail on fatigue, as it appears to receive little attention during diagnosis, and yet it can have a major impact on the ability to work and our relationships with loved ones. I hope you find it interesting. But first, I have a little clip from Craig Sloan, who's the newly appointed CMT UK Scotland Regional Support Group Coordinator.
So for me personally, fatigue comes from activity during the day. So the more that I do, the more tired I get, and has a knock-on effect into the rest of the day, the rest of the week. So how I manage that, typically as if I'm doing an activity where I can take a break, as I'll take a 5-10 minute rest break before going back to whatever I was doing at the time. I also try to avoid things like caffeine and Red Bull, because I found that drinking caffeine tends to make you feel more sleepy after you take it, well for me anyway. And on hydration, I think it's important to drink a lot of water, to eat a really good diet. I think that helps. And also I would say just don't overdo it, because you'll feel worse, and again that'll have a knock-on effect into the rest of the week.
And now it gives me great pleasure to introduce Dr. Mario Saporta, Professor of Clinical Neurology in Miami, Florida, to deliver this presentation. Dr. Saporta.
So today's webinar is basically a way to give all of you participants of the CMT&Me study some feedback of some of the findings of this project. And today we are going to focus mostly on fatigue, but we will also give you a quick summary of some of the data and findings that we have so far from this study. Next. So the first slide is really to review why we're making you all spend some time in the app and putting data. It's very clear that there's very little published research on the daily lives of patients with CMT. What are the main issues that affect their quality of life? What are their main challenges? And the idea of this project is to capture real-time and real-life data directly from patients with CMT to improve our understanding and also raise awareness of how CMT patients are not only currently managed, but also what are the main issues and challenges that they face. We are hoping to identify gaps in CMT management and contribute to changing it in a positive way. Next. So the indication for this study, it's basically any type or patients with any type of CMT, including CMT1A and all other subtypes. It is an international digital lifestyle study where we are capturing data from patients, so data that patients are providing and not being collected by any investigator or research group. It has ethical approval, as any research study has to. Our cohort is only of adult patients. We have now over 3,000 patients registered, about 672 in the UK. It is the database and the platform has been co-created with patients, with members of patient advocacy groups from across the globe, and also clinical key opinion leaders. It has been launched in October 2018 and will continue until at least the end of this year. The data that we're capturing are detailed demographics and profile information and a broad range of patient-reported outcome instruments to quantify burden of disease, looking into different dimensions of that disease burden. This is very important for any study collecting patient data. There is specific care taken to protect data privacy and security. Access to data is controlled by an independent scientific advisory board, which is comprised of both clinical leads and patient advocacy group representatives. We are always aiming to have very strong academic rigor, and the scientific advisory board makes sure that we provide very timely and clear scientific advice to conduct this research. We meet at least once every year to discuss the key study findings and work on manuscripts to present this data to the scientific community. FarNext is the sponsor of this study, but it only has access to aggregate anonymized data and under the supervision of the scientific advisory board, and they do not have access to individual patients' data. Both Vitaxis and FarNext are subjected to the EU data regulations in their access and use of participant personal data. And as I mentioned, the study has been approved by an ethics committee in accordance to best research practice. So we're now going to run through the key findings from this study. We are almost 3 years after starting the study, so we have a lot of data now collected. This is a breakdown of the types of CMT that patients have who joined the app and the database. It really represents the distribution of CMT subtypes that we have identified in a previous study looking to clinical data of participants in different CMT centers or CMT institutions. So the most common type, CMT1A, accounts for about almost 2/3 of patients. The next one in frequency is CMT type 2, which actually comprises of several subtypes of CMT. And then CMT1X is the next most common one. And then the other ones will be individually very rare and less common, including type 4 or the recessive forms of CMT, other type 1s, and HNPP or hereditary neuropathy with liability to pressure pulses. Next. All right. Now looking to symptoms, and this is fairly consistent. I'm sorry, just looking at some questions showing up here, but that's fine. So those, I'm going to answer questions on the Q&A section at the end. So I'm seeing questions kind of starting to show up on the Q&A tab, but we're going to talk about those questions later on. So looking to symptoms, and this has been fairly consistent among the different countries participating in the study. We can see that hand and feet impairment are very prevalent in patients with CMT and all subtypes of CMT. When you look at subtypes, the major difference is when you look into difficulty walking, where the CMT4 patients or recessive forms have a higher prevalence of patients having significant issues with walking, and that's likely related to the severity of those cases, which is higher than of the average CMT patient. And then we see fatigue coming on kind of on the third place here for most types of CMT again. And that's what we're going to be focusing next. Now, looking to associated conditions, we know that there are, of course, other medical conditions. CMT will not protect you from other health issues. But then we start looking into things that are highly prevalent in CMT patients and higher than in the general population. And those include anxiety and depression, gastrointestinal problems, and respiratory problems as well. And just again, just to finish up on depression, this has been actually very high, or at least the highest in the US and UK populations, and the lowest rates were among patients in France and Italy. Now, looking to the diagnostic journey of patients with CMT, and I think you are all going to relate to that. On average, patients with CMT in our study have reported that their first symptoms started around age 18, so late teenager years, but they were not diagnosed until age 28. So that's around 10-year gap between start of symptoms and diagnosis. And this is consistent with what has been published before. And it is a major concern on the CMT field on how to improve and reduce this gap so that we can identify patients as early as possible, as this will have a significant implication once treatments are available. Next. And now impact on quality of life. And this is, again, something that we will focus more on the second part of this webinar. Here we have different dimensions of factors that will impact one's quality of life. And this has been specifically studied in this project. We look into pain, sleeping disorders, fatigue, and disabilities both in the lower extremities and in the hands. And as you can see here, pain significantly interferes with the quality of life of patients with CMT, as well as sleep disturbances and also fatigue. Those are all highly impactful in patients' quality of life. When you look into disability related to lower extremity, this is also kind of reaching the higher level of impact, and then hand involvement comes in kind of in the fifth place there. But all of them will have an impact in quality of life, and they're all really potential areas where patients and their physicians should be focusing on to improve their quality of life. Next. And this last slide on our kind of general data, it's reporting what specialists patients are connecting to manage their CMT. And as expected, number 1 and 2 are family doctors or GPs and neurologists. And I think there's no surprise there. But it's important to realize that there are other team members of a CMT management team, and this we include orthotists, podiatrists, physical therapists, orthopedic surgeons, and other health professionals. And it's very important because this is really the model that most CMT centers are adopting now, where we have, if not all, at least most of those specialists with us in the CMT clinic to see patients together as a way to really identify the major issues, the major challenges, and the major opportunities to treat patients and improve their quality of life. So now we're going to switch gears to really talking about fatigue and how we are analyzing fatigue and what are the main data and the main conclusions that we're getting from this analysis. This is based on results from all the countries that participate in the study, so France, Germany, Italy, Spain, the UK, and the US. And the data was basically analyzed up to June last year. So let's go back to one slide back, please. There we go. Okay, so and here I have to give a disclaimer because we are going to be focusing on really a subset of a subset of a subset of patients. You're going to notice that the number of patients will start decreasing significantly, and of course this will impact our ability to generalize anything that we find in terms of data or trends. So I think it's important to keep that in mind, that we'll be really talking about a small subset of patients, but even with that disclaimer, I think that analysis will provide very important conclusions, or at least very important concepts that we will explore when discussing fatigue and CMT. So we are talking about initially 92 participants, and for this analysis we are focusing on CMT1A. And we used the fatigue score to basically define a subgroup of patients with severe fatigue. And of all the patients that were participating in the study, 92 participants actually fit that description. 23 in the US, 33 in the UK, 10 in Italy, 13 in France, 6 in Spain, and 7 in Germany. 82% of those patients were female. They had a mean and median age of 45 and 46 respectively, and a mean and median age of symptom start of 17 and 12 respectively. And as we mentioned before, with the 10-year gap, the mean and median age of at diagnosis was 27 years. The mean and median length of time receiving medical care was 21 and 20 years. So even once they were diagnosed, they still that's the other way around. So they actually reach a physician about 6 to 7 years before they actually receive a final diagnosis. 47% of those patients had moderate symptom severity at diagnosis, and 15% severe symptom severity. 48% of patients reported moderate symptoms currently, and 44 severe symptoms. And the highest reported type of symptom of importance is weakness in the hands and fingers, in keeping with the general population of this study. Next. Now, looking to things that patients, I think we skipped one slide. Yeah, there you go. So looking into what patients were doing to treat themselves or improve their quality of life. 20 patients with severe fatigue who reported that they were using any kind of medicine now or in the past. Most of them were using either analgesic or painkiller medications or antidepressants. And I think that's kind of one of the first points that I would like to present is if you look at fatigue in any neurological condition, especially chronic neurological conditions, it is not a unidimensional problem. It's a multidimensional problem. And of course, we always have to look into the possibility of depression and anxiety being a component of that symptom. We know that depression will cause lack of energy, lack of interest on activities of daily life, and depression is highly prevalent in patients with chronic conditions. So identifying depression and treating depression appropriately, it's a very important step on managing fatigue in patients with CMT and other chronic conditions. Next. And I'm sorry, I forgot to mention that we are going to have now polls for some of those slides where we're going to ask you questions about the topic that we're discussing. So for this one, we would like you to let us know what impact has fatigue had on your mental health. And those are the options on your screen. If you could select one, and then we'll see what the results were. And we'll give you a few seconds to finish this up, and then we'll see a summary slide. Okay. So I mean, the majority of you selected it causes occasional bouts of low mood, and that's of course completely understandable. And it is kind of a chicken and the eggs kind of situation where depression can cause fatigue, but having fatigue will also impact your mental health. And I think that's clearly shown here. At least 14% of you has mentioned that it has a severe impact. So again, I think that's a very important thing to keep in mind when we are managing fatigue and CMT as a whole. All right, so let's move to the next one. And this next one looks into physical therapy and fatigue. Here we're looking into 19 participants with severe fatigue that reported having physical therapy now or in the past. And you can see that those numbers are comparable between severe fatigue and non-severe fatigue. And when it comes to occupational therapy, the severe group had a little more than the non-severe. Here, I think this data doesn't really capture another point that I think it's very important when talking about fatigue and CMT, which is physical conditioning. Meaning we know that because of CMT, a lot of patients will have a very hard time keeping themselves physically active, and losing physical conditioning will cause fatigue as well. So something that we always try to work with our patients to accomplish is finding ways to slowly and gradually get them back into some kind of physical activity program. And that can really vary from going to the gym, swimming, riding a bicycle, anything that can make your body work and your heart a bit faster, and improve your cardiovascular endurance will be very helpful on managing fatigue. Physical therapy has a very important role in this process because it allows us to identify the best type of physical exercise and program for each individual patient. And although the data doesn't capture it, it'll be very interesting to look into what kind of physical therapy patients were receiving, and if the physical therapy was actually appropriate for their CMT. Another thing that we always discuss in clinic is that physical therapy is not a single entity. And at least in the US, we have an issue of most physical therapy offices and facilities focusing on sports medicine and orthopedic conditions, and not really understanding the needs of patients with neurological conditions and specifically with neuropathy and CMT. So I'm always make an effort to help patients identify places where they have the expertise and the experience of performing physical therapy in patients with neuropathy and CMT. Because the sports medicine orthopedics approach will actually be most of the time counterproductive for CMT patients, because it's not going to be gradual, it's not going to be focused on what the main issues are, and can actually be detrimental. And I have heard many times patients saying that they actually fare worse after starting physical therapy than they did before, which is really not what we would, of course, be looking for or even expect if this physical therapy is appropriately planned and given. So now, with this in mind, I would like to hear from you. Does physical therapy reduce your fatigue? And that's basically yes or no, or I don't know question. So please vote. All right, so 1/3 of you said yes, it does help to reduce fatigue. About 23% said no, and 39% I don't know. And I can understand that. Again, I think we really have to look into the quality of physical therapy to draw any major conclusions. But again, I would like to reinforce that having a physical therapy plan and especially reconnecting with physical activity as something as part of your life, it's very important to help manage your fatigue. So I would recommend for all patients to look into that. Now moving on to walking aids, and that's the third message of the day. With CMT and the foot drop that's caused by CMT, your whole body has to readjust to maintain your ambulation, your mobility, your ability to walk. And that's a very expensive process from an energy perspective. So you are basically operating at probably 120, 150% of what your body has been designed to do. And usually using accessory muscles and muscles that were not primarily designed to be working on gait and during walking. And this will cause fatigue as well. So basically you are exercising kind of throughout the day when you're walking. And this is fairly true and more acute in patients that are not wearing braces when they need to. So here's a breakdown of patients' use of walking aids, again, from severe patients with severe fatigue and non-severe fatigue. The number of patients wearing insoles, it's actually higher in the severe fatigue group. But when you look at ankle or leg braces, you see that there's a kind of a small difference, but still a difference towards patients not wearing them compared to patients with non-severe fatigue. So again, it's very important to keep in mind that if you have foot drop and if you have to use a lot of your hip muscles and thigh muscles to compensate for the foot drop, it's very important to consider a brace, an ankle foot orthosis, because that will help you regain a physiological gait and save you a lot of energy that you're expending to ambulate. So again, that's another point that it's very important to make and keep in mind. Now, next one. And exercise, as I mentioned before, is very important, and it is a component of how we manage fatigue in patients. It's a little counterintuitive because you think, oh, if I'm fatigued, I'm not going to be able to exercise, and that's true. But that's true with patients with obesity, with diabetes, with cardiovascular conditions. Once you're able to break that cycle and slowly but continuously increase the level of physical activity through time, you would see an improvement with fatigue. Here we can see that the patients with severe fatigue tend to exercise less frequently than patients with non-severe fatigue. Again, it's a chicken and eggs kind of situation where it could be in any direction. It could be that they have fatigue because they're not exercising, or they're not exercising because they have fatigue. But at the end of the day, it is a vicious cycle that would just make the fatigue worse and the physical deconditioning worse, and the fatigue would get worse. And breaking that cycle is very important. So just to keep that in mind again. Next one, a very important issue of how CMT and fatigue is impacting your ability to work and study. As you can see here, almost double the number of patients or the percentage of patients with severe fatigue are not working because of their disability compared to non-severe fatigue patients. And that's a very important point, because that's kind of a component of CMT and the cost of CMT, not only to patients but society, that I think it's not appreciated, and it's very important to also have that out there for regulators, for politicians, for the society to understand that there's a very important cost of those chronic conditions that are not being taken into consideration. Now, looking to this issue, we have another poll regarding the impact of fatigue on your career and your employment. So what impact has fatigue had on your career or employment? And those are your 5 options. So if you could please pick one and let us know. All right, so we have kind of a tie between patients that had to give up work completely because of their fatigue in CMT, and the same number of or percentage of patients that are still working full time. And then 21% of patients had to reduce the number of hours to basically cope with their CMT symptoms, and 15% had to change the job that they had because of their CMT physical issues. So it's fairly evenly distributed. And it's always interesting to look into this question and correlate that with, of course, severity of CMT symptoms and duration of symptoms, and also the issue of fatigue. But that's, again, what we commonly see as well. All right, so let's move on now to the next slide. Let me see here. Okay, and again, here we have very small numbers. We have 8 patients responding work impact questions. All of them, as some of you did, reported that their fatigue has impacted their ability to work. And I think we have another question here, which is a little different. So it's not related to work impact, but how fatigue has affected your relationship with your partner, your family, your colleagues. So if you could give us an answer, and those are your 5 options. All right, so the majority of you has selected it has affected the physical, intimate aspects of our relationship, which again, it's a common issue with patients with chronic neurological conditions, and fairly badly or insufficiently approached by both us physicians and the research community. 28% of you said that it has not affected your relationship at all, and 13% mentioned that it has caused stress and tension, which are threatening on the relationship. But thankfully, nobody selected it caused a breakdown of the relationship. But it is a very significant risk, and something that we always would like, of course, to avoid. So really tackling fatigue and the physical impairments of CMT, it's very important in that dimension as well of your relationship with your family and with your partner, of course. Now, the next slide, I think it's a very important one, which deals with sleep disturbance. If you look here, again, on the comparison between patients with severe fatigue and patients with non-severe fatigue, a high proportion of those patients reported moderate sleep disturbance, which is very important, and it's something that we are now realizing that it seems to be an issue in CMT. Neuropathy is known to cause issues with sleep, especially restless leg syndrome or symptoms, and also a correlation with sleep apnea. And we are now starting to tackle that more directly, screening those sleep disturbances in our patients, because it is another dimension of fatigue that can be approached and can improve patients' quality of life and reduce their level of fatigue. Now, having that in mind, if you could answer for us the question 1 on sleep. Do you have any sleep disorders that you are aware of? Okay, so about 2/3 of you answered yes, and again, I think that's very significant and way higher than we would expect in the general population. So sleep disorder is something that we have to always have in mind when patients have fatigue, and we've seen that in other neuromuscular conditions like muscular dystrophies, and managing sleep disturbances are very important and helpful to manage fatigue in patients with CMT. Now, the second question on sleep is, are you taking or have you ever taken a medication to help you fall asleep or improve the quality of your sleep? Okay, about half of you said yes. So again, that's very important. And the other point on this is most of the issues that CMT will cause would on sleep specifically would require not only medication but sometimes either a CPAP or like a respiratory positive pressure support at night, and other management approaches that may go beyond medication. So it's very important to discuss this with your physician and actively look into the possibility of sleep disturbances being a component of your fatigue. And moving on to pain, as you can see here, pain is a component of CMT. Usually not necessarily related to the neuropathy itself, but to the joint ligament changes that will be secondary to the neuropathy. So more of a musculoskeletal pain than necessarily neuropathic, but in any way, it is a very important component of CMT and can also be related to fatigue because it can interfere with your sleep, it can interfere with your ability to perform your physical activities. So all of those are important ways that pain can impact your fatigue level and your quality of life, of course. So again, just looking to the comparison of severe fatigue versus non-severe fatigue patients, a smaller proportion of patients reported having pain intensity within normal limits, and a higher proportion of patients reported having moderate and severe pain. So again, a very important aspect of severe fatigue is the correlation with pain. And our last data slide is related to how pain interfere with their life or quality of life. Of the 28 patients with severe fatigue that responded to these questions, over 85% reported moderate to severe interference compared to the non-severe fatigue group. So again, just showing how pain will impact your quality of life and your fatigue levels. Now our last questions for you, and I think it's a very important one because it made me think about how we screen fatigue in our clinic, is during a consultation where you ask to complete a questionnaire to assess your fatigue level. And again, that's a yes or no question. Right, and as I was expecting, 81% of you said no, and again, that's a mea culpa kind of moment because we don't screen fatigue for CMT patients with a specific instrument. We always talk about it because it is something that every patient will report at some point. But for some conditions like Pompe's disease, which is a type of muscular dystrophy, we actually have used very specific questionnaires to keep track of fatigue, and After today's talk, I'm strongly considering doing that for our CMT patients as well, because as you all have seen throughout those 30, 40 minutes, it is a very important aspect of CMT and an aspect that we have overseen for far too long. So this is basically kind of the summary of the data that I wanted to present today. Our next slide is a thank you slide for all of you that has been part of this study. It's very, very important to have this kind of work because we can do a lot of academic-based research. Of course, that's important by itself. But having a real-life data and understanding of the disease of CMT, it's very important. And it will help us design better instruments and better trials to really test whether a treatment or a intervention actually impacts what it's important for patients. So if we are always focusing on our view of CMT and CMT impairment, but we don't take into account what patients' experiences are and how they feel CMT impact their lives, we are probably going to be always aiming the wrong things on a trial or when we're looking into a treatment. So having this information, it's very, very important. And we thank you all for your continued support. It's very important to also stress that we do need you to keep feeding data in the app, keep giving us this longitudinal data, this idea of how the CMT is affecting you throughout time, because this is also very important for our clinical trial design decisions. Understanding what's changing over time and how fast it's changing help us identify what the best metrics would be for a trial, because as you all know, trials have a very short life. It cannot last for more than a year and a half, 2 years, because it's a very expensive endeavor. So having metrics that are very fast responsive are very important to be able to detect impact or response of treatments in patients. So again, thank you so much for being part of this study. And what we're going to do next is open for the Q&A session, and we have about 15 minutes, so I think we have a good amount of time to go through some of the questions that have been placed on the Q&A session, and I will again encourage you to ask questions if you like. So we're going to go from the first questions to the most recent ones. The first one is the summary study data research findings available in a downloadable report? No. So this data is being continuously published in scientific manuscripts. So it's slowly becoming available to the general public, to the general scientific community. So there's no version that's kind of like those slides, but this data is becoming available through publications, and I think we probably have 5 or 6 publications out there already. So just keep track on that, and once the study is completed, I believe we should have other webinars like this, and at that point some of this data will become available as well. Second question is, are you helping to feed data into drug trials, research studies like the phase 3 PXT3003? So those are 2 separate studies. The phase 3 trial is already ongoing and almost completed. So all this information that we're getting would not have been timely for that specific trial. But because we're publishing this data and we're making it available to the scientific community, our hope is that this data will be used for designing future trials for CMT. So the answer is yes, this data will help feed information to drug trials in the future, but not to the ones that are already ongoing, like the PXT3003. Third question is eye fatigue common? I wear reading glasses, no other problems, but my eyes just feel very tired at times. So there's some forms of CMT that can affect your vision. They are not the most common types, and 1A, which is the most common type, does not, as far as we understand, affect your vision. So I would definitely look into other possibilities. Eye fatigue and those kinds of symptoms are common with aging and also with our digital life. So making sure that you're not overdoing on that regard, it's very important. And I just want to quickly take this question as an opportunity to just formalize a little bit what I was talking about, the different dimensions of fatigue. We are now thinking of fatigue in CMT having at least 5 different dimensions. And we talked about them, I think all, but just to make sure that you have this in your mind. So physical deconditioning is a major component of fatigue in CMT. Sleep disturbances are a major component as well. Increased energy expenditure due to compensations in walking, especially if not wearing braces. It's a major issue as well. The psychological impact of CMT with depression and anxiety, it's the 4th component. And then the 5th component, which I think has to do with this question of eye fatigue, is things that are not related to CMT. So fatigue, I think it's impacting almost everybody at different degrees. And that has to do with, again, our digital life. We are always connected. We are not being able to disconnect from either social media, the internet, the screens. So being very aware of this, it's important as well, because you are going to suffer from things that are not CMT related, just like anybody else would. But because you already have 4 other things that are affecting your fatigue level, the 5th one will just make things even worse. So always take very good care of your general health, your general habits, have a healthy life, healthy diet, healthy sleep, healthy exercise, and healthy digital life as well, because that will impact your ability to live and to function when it comes to fatigue. Another comment was, I answered don't know to physical therapy because I don't receive any. I suspect the majority of us are in the same position, and I definitely relate to that. It's very frequent that we get patients in the clinic coming for a first evaluation and they're not doing anything because they went to a doctor 20 years ago, 10 years ago, and were told that there's nothing to be done. CMT, it's a genetic condition that's incurable and just deal with it. But that's not true. From knowing what type of CMT you have, to doing physical therapy, to using or wearing braces, to keeping a healthy diet, a healthy lifestyle with physical activity, all of those things will be very impactful to your quality of life living with CMT. And not doing all of those things will impact that in a negative way as well. So I will again very strongly recommend that you reconnect with your doctor, or find a new doctor that has experience with CMT, so that you can go back to physical therapy, go back to a exercise program, because that will have a very positive impact in your life. Next question is, can we find out the number of participants to the poll so we better understand the percentages? So as I mentioned, all the percentages that were presented were based on a subset of patients. So it's not the 3,000 patients that are part of the study. It's a very small proportion. They were on the slides, on every slides, and they range from 80 to 20 patients on the severe fatigue group, and then usually 4 or 5 times those numbers with the non-severe fatigue group. It does reduce the strength in terms of statistical analysis that we could do with this number of patients. But as I mentioned, I think that the important thing about what we're getting here is really the messages that we discuss about the dimensions of fatigue and how to approach them, each one of them individually. But I take your point, and that's why I made the disclaimer initially, because it does reduce the power of any correlations that we can make because of the small number of patients. Do you see a correlation between symptoms and cold weather or poor blood circulation? This is anecdotal. I live in Florida, so we have warm weather. We have a lot of patients that move from cold weather states to Florida, and they do see, and one of the major reasons is the weather to begin with. So from this N of 1 or N of small number of patients, we do see them having a better quality of life in warm weather. And that's a little expected. We know that cold weather will make your nerves conduct even slower than they would otherwise, would make your muscles work a little harder than they would otherwise. Your blood circulation can be affected as well. So yes, I would say, again, that's non-scientific. We don't have a very large study looking to this, but we do believe that there is a correlation of cold weather making CMT symptoms a little worse. Next comment or question. Thanks for your accurate and sensitive analysis. Will there be studies, updates along time, and publications? As I mentioned, yes. There are publications being written right now and being submitted to scientific journals. We'll keep our webinars going as long as we have new data to present. So this will be a continuing, yes. What is the app you mentioned about filling out data? That's the CMT&Me app that we were talking about from the beginning. It's a app where you download the app to your phone and you can input data continuously, and this data is analyzed by Vita Access. How do I participate in clinical trials in the UK? Unfortunately, I'm US based, so I have a lot of collaborators in the UK. You have a very strong CMT program in London. So I would say connect with the CMT Center in London at Queen Square, and that'll be probably the most straightforward way to participate in clinical trials. There's an ongoing trial for a very rare type of CMT called SORD neuropathy that's underway here in the US, but also in the UK. And we're expecting that other trials should be starting within the next year or so. So connect with a CMT center, either in the UK, France, Italy, Spain, Germany. All of those places have very good and very advanced research and clinical centers for CMT. In the US as well. You can look up on the CMT UK website, the CMT Association of the United States websites. They will list some of those centers for you to be able to find them. Is there evidence to prove that CBD products are effective to help with sleep disturbances? I don't want to be on pregabalin, but for the rest of my life, and would prefer to try a more natural approach. The whole CBD medicinal marijuana field, it's still developing. Again, from an anecdotal perspective, we do see patients responding to those treatments, especially patients where we tried everything for pain, for sleep, and they didn't really show any improvement, and they did with CBD. This is not a scientific really data that I'm presenting, but something just to keep in mind as an option. I think it's important to also realize that CBD is kind of natural, but it's already a manipulation of a natural product. So I always have a little bit of an issue of how natural those things are, meaning if you want to try CBD, what's the problem with pregabalin? They're all medications at the end of the day. They're chemicals that are working in your brain to modulate your ability to feel pain, your ability to sleep. So I would consider them within the same class of interventions, honestly. Have you any tips for how to manage fatigue? I feel like I can try and keep going, but hit a brick wall between 3 and 4 p.m. So that's really what I was trying to convey, talking about the different dimensions of fatigue. Each one individually is a point where you can work on to try to improve your fatigue level, improving your exercise or your physical conditioning, improving your sleep quality, improving your mental health, improving your gait, specifically if you're not wearing braces, if you're not going to physical therapy, and lastly, managing your health style, making sure that you're not on a screen until late at night, messing with your sleep, that you're not eating badly, that you're getting all your vitamins, your water intake, your minerals, everything. All of those will be important to help manage your fatigue. And it's not going to happen from throughout like overnight. It's really a process. It will take weeks, months, but it's something that you have to build gradually, and hopefully with time you see an improvement. All right, let's see how we're doing. I have 3 more minutes and a bunch of new questions. Is poor hearing a common factor as CMT progresses? I'm only in my 40s. Yes, we know that hearing loss is common in CMT, and certain types of CMT will have it more frequently than others, usually the demyelinating types, and some of the recessive types have it as a feature of the CMT. Unfortunately, just as the neuropathy, there's nothing really we can do to interfere with how it progresses until we have a treatment for the CMT. But it's important to connect with an ENT to help with hearing aids or other strategies to help with the hearing loss. But it is a known component of CMT, and we're understanding it more and more as part of the disease. Next question is, I have type 2 but don't fit into a subgroup. I came off my feet age 25. Lots of questions on the app. I find it hard to enter questions as it's based on walking, seeing tears. I have severe fatigue, which affects my everyday life. So yes, I understand that once you get to a certain severity levels, a lot of the questions will not apply to you because you're not able to walk or to use your legs throughout the day. And of course, this is the hardest situation where this will impact everything that we discussed about your ability to remain physically active, your ability to have a good sleep quality, but at the same time, we have patients with very severe neurological conditions like spinal muscular atrophy, Duchenne muscular dystrophies, where we just find ways for them to keep some level of exercise. And this could be using the bicycle with your hands or arms, doing other types of exercises, respiratory exercises, things that you can do even without being able to walk. And this is important, again, to try to increase your conditioning level. The fact that you don't fit into a subgroup, having type 2 is not unexpected. Probably about half of our type 2 patients don't have a gene identified. So that tells us that there's a lot of genetics that has still to be understood for type 2. But there has been progress being made over the last years. So I'm confident that with time we're going to find your subtype and type 2 patients subtypes. Did you got patients from India? If not, why? I think this study is limited for the countries that are listed, those 6 countries, and this has to do with the regulatory aspects of things. Having an app would theoretically open the possibility of including patients from across the globe, but because each country has a different data privacy and management process and policy, unfortunately, those studies have to be limited to a specific set of patients, of countries. We have a bunch of questions that has been kind of coming up, but we are reaching the top of the hour. It's 8 o'clock here in Miami, I think 1 p.m. at the UK. So we will try to address any questions not answered in our post-webinar communications, emails, social media. And I would really like to thank you all for being part of this study, for being connected to this webinar and learning more about CMT. And I hope to see you on our next webinar. Thank you very much.